live.
Good evening, everybody. In continuation of our continuous integrative medicine updates, today we have with us a very special guest from Bangalore, who is actually a biologist and a biochemist, and also a Padma Shree, Dr. R S Rao. He is an Indian scientist, and he was president of Jawaharlal Nehru Center for Advanced Scientific Research, Bangalore, where he still serves as the emeritus professor. Since we have been discussing various aspects of integrative health, including Ayurveda, yoga, modern science. Yesterday, we had a lot of discussion on imaging that is being carried out in various meditation protocols, and what are the changes that happen in the brain. And day before yesterday, we had discussions on the experience sharing by a sadhaka or a meditator, how you feel when you meditate, what is the experience, and does it have any health promoting effects? And even one day before that, 2 days before, we had Dr. Dilip Sarkar, who was an MD, joined us from US talking about the clinical benefits of yoga, how it activates the parasympathetic, how does it pertain to the parasympathetic response and alters various biochemical parameters such as cortisol and all that. So today we thought it would be very nice if you could have a biomedical or a molecular, or you can call it biochemical inputs and insights into how we can discover the beauty of the Ayush system, the yoga, or any of the drug development strategies. How do the drug development takes place? And above all, what are the educational requirements for doing such research? And I know that most of you are from different disciplines. Some of you are biologists, others are from completely pure clinical sciences, others are from the yoga and the Ayush systems, and some are policymakers. This may be useful for all of you because the person we have with us is very well, very knowledgeable, very much experienced, and knows both the biology, the bench work, as well as being into policy making. He's the fellow of most of the academies, the INSA, he's also been a task force member for ICMR, CSIR, DBT. Most of these are funding agencies which fund research. And Dr. Rao is a prolific scientific researcher, and most of his research work has been focused on chromatin biology and cancer biology. So what are the mechanisms involved in cancer and how we can arrest it? And in particular, the role of chromatin, what role does it play in cancer? But you will discover through our interactive session today how these techniques and these tools are fundamental and also common to most of the investigations we do, whether it is for disease or for health promoting effects, or and how do they come about after our good training, and how are they related to our qualifications, whether it is from the basic biochemistry or biotechnology background, how you look at the world. If it is from the clinical background, how do you look at the world and the research situation? And if you're from Ayush background, how do you look at the world? And therefore, all these disciplines are important, and they need to be integrated to have a holistic and a total view of how they can be translated for social benefit, for the health benefit. So without much ado, we will start chatting with Dr. Rao, and I will ask some questions which I thought would be useful to all of you, and Dr. Rao will try to answer them. So here is the first question to Dr. Rao. Maybe before that, Dr. Rao, do you want to make some opening remarks? You want to say something before I ask the first question?
Welcome everybody for this interactive session. I'm happy that I've been asked to be part of this exercise. Particularly, I know Akshay Anand for a long time. I think he has been doing excellent job of conducting all this yoga exercise and also educating all the yoga people, yoga scholars in terms of the modern medicine, etc. So I'm happy that I'm here. I'll try to answer as much as possible to the questions what Akshay is going to ask me. I'm very particularly happy that, that being a basic biologist and then engaged in biomedical research for almost 3 decades, we can tell that now we have come to a stage where biomedical research cannot be only at the modern science level, but we have to integrate various the health aspects including the different medical fraternities, Ayush, Yoga, etc. I think I'm very happy to be part of this. I'll try to answer as many questions as possible, Akshay.
Thank you. Thank you, Dr. Rao.
Yeah.
So the first question is that most of us follow a very predictive career advancement pathway.
Yeah.
So a bachelor's degree person gets one who wants to do a PhD or become a scientist typically gets a bachelor's degree, then gets a master's degree, either a master's in science or master's in technology or an MTech, either of the IITs or the medical institute or just CSIR or DBT institutions in India at least, and then goes on to get a PhD, and then after a PhD typically gets a postdoctoral fellowship either outside India or any of the premier institutions in our country. Uh, are you very comfortable with this pathway? You think this is the right way to probe the beauty or the mechanisms underlying disease and pathologies? Are these sufficient? What is your reaction to this pathway? You must have undergone the same pathway.
I have gone through the same pathway, but I still feel that the pathway has merits because you need to have fundamentals of chemistry, physiology, biochemistry, and then genetics to contribute to the health sector. Only after getting the master's degree or during the PhD, you need to get additional skills so that you make a contribution in holistically in terms of the biomedical research. I can tell you that the biology has grown. Biology, I mean human biology, has grown very significantly over the last 2 decades, particularly after the human genome sequencing, etc. So to integrate the human biology to the medical fraternity, I think we have seen a tremendous growth over the last decade. The biomedical research is converging very nicely. Even the reductionist approach of the modern science are appreciating that we need to see the human biology of the diseases as a system problem, not as an individual molecule problem. So in that sense, no integration is necessary or to the holistic or the system problem. But for that to be very beneficial, and now I agree that it has come to a stage, although I agree that pathway I went through is the right one, but we need to devise newer ways of providing the knowledge of additional disciplines to make it a holistic approach, even during the BSc level, MSc level, or definitely at the PhD level. And then a biomedical research, until today in the Western countries, the MD PhD program, and then the medical people doing the basic science in the laboratory after their clinical tour in the OPD or the surgery, I think they do a lot of basic research. So they go back and forth in terms of the clinical science as well as the basic sciences. So in our countries, that is lacking a lot. I think it's very necessary that this integration of the classical physiology, genetics, and biochemistry in terms of the anatomy. I forgot, anatomy is another important area. Like when you want to do a human biology to explain the disease, very few people know the human anatomy. Like a basic scientist like us, we don't know very little of the human anatomy. So in this direction, I feel that knowledge of anatomy, physiology, and biochemistry and genetics should be available both for the medical people as well as the basic science people. How do we do it? When do we do it? But it is necessary today for modern biomedical research. And again, research, we need to have an education system so that we can do a proper research and good research in the biomedical area. So it is integrated education research go hand in hand. So how do we contribute to the education and biomedical research? I think that is where our policy makers should worry about in terms of providing additional skills in terms of looking at the human body as an integrated system biology. I think it is happening in the worldwide. I think many of these countries, including India, have to cope up and then see that this knowledge is given to the younger people so that they become very good the biomedical researchers. And also everybody need not do biomedical research, but they can use the knowledge for many of these societal problems, etc. I think this is the way to go forward.
You're right, because the people who have done MD, and especially people in the West and Europe, they have MD PhD. Japan has an MD PhD program, so they are trained in anatomy and physiology that you mentioned is lacking in the basic science career advancement pathway, are actually endowed with the skills of clinical symptom documentation, understanding, and then going to the labs to learn the molecular techniques, and then go back to the clinic, and then to the lab, or collaborate with people in the lab, and they are able to get an insight, at least from this sort of hopping between the clinic and the lab, and with some because they can have MD students working on thesis that hovers around biochemical or sometimes molecular research studies. At least
Yes.
this ecosystem exists, at least in the medical institutes in India and outside.
Yeah, yeah.
But you rightly said, in contrast to that, the entire group of BSc, MScs, and PhDs not even are exposed to anatomy and physiology. So even though they are doing recombinant DNA technology, cell culture, stem cell manipulation program strategies in the lab using culture systems or animal modeling, and then trying to rescue the phenotype in the animal, they still lack the ability to translate that knowledge for clinical benefit, because they're not exposed to the medicine. They are not exposed to how patients come, walks into the clinic with a certain profile of symptoms which defines a disease, or what is a pre-disease, what is a full-blown disease, what is infectious disease, what is non-communicable disease, and how the disease progresses in a human being. That particular knowledge is lacking. So you said that there should be something that could be done. So
Yeah,
what
yeah.
can be done to combine these two skill sets into something more useful and more important, and maybe significant for taking India to a leadership level?
Like I was fortunate that I was one of the very few people, even during a master's degree in chemistry, specializing in biochemistry in the second year. We had a professor here in the Bangalore University who was very visionary. We had only 8 students specializing in biochemistry in the second year. But he made us to go to the Bangalore Medical College and learn physiology and also anatomy. So very at a very early young age, we were given that opportunity. See, it was not for mandatory to learn that. It was not a syllabi in our MSc syllabus, but still he made us to go to the medical college to see that we are given a flavor of physiology and anatomy. So this has deep-rooted in my mind that has helped me to appreciate the other aspect of medical field, although I have grown up as a basic biologist. So this is very important. I think, I think I have shared with you some of these thoughts with you. The biomedical researchers in the country today, there are many PhDs who are doing biomedical research after PhD in their young faculty members in the universities and the CSR labs, the DBT labs, etc. They have taken up biomedical problems, but they do the molecular work, but they don't know after getting the molecular work, how to appreciate that work in terms of the total human being. Okay, that's where they lack in terms of total appreciation of human biology. What it means, what the molecular details, what they are understanding, it will be very, very small piece. But unless you integrate into the system as well as the medical physiology, it will be very, very minuscule contribution to the total biomedical area. So I've always conveyed to the many of the people in the country that, maybe even young researchers who are young faculty, they should be given crash course of a 6 months or a 3 months or a 2-year, 3 period, that they should be exposed to physiology, anatomy. Okay, that way the research will be benefited.
Correct. So do you think, if I can use your the way that you are indicating the importance of short-term exposure to the clinical environment, whether in a ward or by having a co-guide who's a clinician,
Yeah.
what are you proposing, or are you open to the thought of instituting a PhD MD program like the MD PhD program already exists those who
Yeah.
are doctors can get a PhD and understand, get insights, the molecular and biochemical or structural biology insights. Can the similar program, is it happening anywhere, or because I
No,
remember
no,
seeing
it happened in the USA long back. Okay, many of the PhDs did a MD, not in the within the USA, but they went to Mexico and they got a MD program. So they came back and then they became a good biomedical researcher. But that may be difficult in our country, whether our Medical Council of India will agree for giving a degree MD for a PhD program, PhD scholars or PhD degree holder. But the via media is that to give this crash course. But
or
it will be the best if they can get a PhD MD, but it is a long struggle to convince the Medical Council of India. But
right?
at least via media would be, they should know what physiology is, what anatomy is. That way, their research can be taken to higher level.
And that is also true for maybe the resistance may come just if the degree is demanded or a program is requested for the practice of medicine. But if it is
Practice of
not,
medicine.
but if it is not for the practice of medicine, just for research, that the
Yeah.
degree of MD for a PhD will not be used for practice,
Yes.
but just for research, just
Yes.
for
Yes.
getting trained in the the clinical pharmacology, anatomy, physiology, and all that constitutes an MD or MBBS.
You know, some of the medical institutions, they have a DNB program. You know about a DNB program.
Yeah,
Whether that can be given like a 1-year DNB program for a PhD faculty.
right. That's a
That will
good.
also help.
Right. And another thing that comes to my mind is about our, the other BAMS or the
Yeah.
homeopaths. They have 5-year BMS. They are Ayurveda acharyas. They are
Yeah.
doctors from the Ayurveda field. And in fact, now yoga has a very well developed and structured program as well.
Yeah.
And they are showing more and more interest in research, and they get excited about molecular biochemistry as well. And there are All India Institute of Ayurveda and S Vyasa in your Bangalore is there also having a lot of degree courses in yoga. How about them also having a kind of a DNB access to modern medicine to be trained in that area of specialty, if not for practice, at least for gaining new insights, which after collaborating with biologists like you and me, they can design questions and they can ask good research questions that
Yeah.
are more that pertain to the integrative health
Yeah.
problems. What do you think of that?
No, that can be thought of in a different way. You know, they can evolve a master's program by research 1 year. You know, this is there in the UK. Many of our BS students they go to UK for a 1-year master's program. I think whether we can evolve a master's program by research, whether the Ayurveda scholar can spend time in the university system to get exposed to this kind of a thing. They are not only learn, but also they can get a degree on that.
That's a good idea. And how about the reverse thing? Our physicians, our specialists, our nephrologists, the surgeons, neurologists, they get patients, they get to see patients based on the modern medicine books they read.
Yeah.
Whether most of them read Harrison and other, whichever discipline they belong to, the books that are in that field, they read those books. But a lot of our Ayurveda, Ayush practitioners often tell us that the patient cannot be just described on the basis of clinical symptoms that the modern medicine describes. They talk of Prakriti, that
Yeah.
the Kaf, Vat, Pit is
Yeah.
also a lot of people, as you may know, Mitali Mukherjee's group and other people have shown the genetic basis of Prakriti as well. And there are people who say that there are three gunas, the Rajasic guna, Sattvic, and the Tamasic gunas. And in their own training and in their own way, they believe that that is the way to look at patients. So is it a good idea for our physicians to get trained in Ayurveda and homeopathy or Ayush, just like the Chinese are trained in TCM or the traditional Chinese medicine?
Maybe I can share with you some experience we had. You know, DST had started a program called Ayurvedic Biology.
Yeah.
Biology, okay, which Meliathan, the chairman of that committee. Okay, I was part of that committee. We funded various Biology projects in the country where the modern science, Ayurveda, Ayurvedic physician look into the problem, into the molecular details. But there was also many good research was done, but the takers are very few. In terms of the rigor and then the quality, we didn't find that kind of a rigor coming up later. Okay, because when you talk about the prakriti, there are only three prakritis. Can you classify everything under three prakritis?
But they say
Go to
there
the
are sub prakritis, I think.
yeah,
So
yeah.
nine.
So
Yeah.
the molecular details, molecular phenomenon, how do you translate to the different prakritis? But excellent work was done. Also, there was a proposal in that task force that can we create a PhD program for Ayurvedic biology to do a PhD in the modern science. But the problem was after PhD, where do they go? Where are the postdoctoral opportunities in the country? Whether the Ayurvedic hospitals, do they create that opportunity? The basic science institute, we may not give them the postdoctoral fellowship because they are flooded with the other kind of people.
Yeah.
So where will they go? They will be stuck.
Yeah.
So a long-term program is not a solution. Okay, they should have their strength in the Ayurveda biology, but they should give them again like a PhD faculty to be given a biochemistry and anatomy and physiology. These Ayurvedic scholars should be given a crash course in the modern molecular biology and molecular cell biology. Okay, opposite of DNB. What do you call it? You can call it with the way it is appropriate and satisfactory, but the opposite of DNB can be created for Ayurvedic people.
But you are talking of the marriage between Ayurveda and biology. I was actually talking about the marriage between the modern medicine and Ayurveda. So can we have within the MBBS and the MD framework, maybe a 4 months, 6 months Ayurveda course? Like I think NIMHANS is probably inching towards that. I am not too sure. But
for that to happen, I tell you, we need to build enough scientific literature for our Indian traditional medicine. Then it will happen. Always there is a doubt. There is where is the evidence-based decision making in all these other traditional medicine. I think we need to spend time, about 10 years, to build up that strength of the modern scientific knowledge for the traditional medicine. Then it can happen. To introduce now itself, it may be very difficult.
But don't you think this is going to be my last or second last question? Well, you're talking of, it's like chicken and egg story, which comes first. So in order to develop this classification and this knowledge from a traditional system of healing, or you call it Ayurveda, homeopathy, or Siddha, you need to have an integrated healthcare system to begin with. For example, a medical institute which sees hundreds and thousands of patients, if they do not have the same people from homeopathy and Ayurveda and Siddha sitting in as professors of homeopathy, professors of Ayurveda, so there will not be comparison for example, for epilepsy between Ayurveda and modern medicine, or for stroke, regular medicine and Siddha medicine. So unless we position or launch or install Ayurveda professors in the medical institutes, or the homeopath professors in the medical institutes, we will not be able to generate data to contribute to what you are visualizing as 10 years of work. So otherwise, how will we generate that work?
Yeah, that's true. Slowly it is happening. Even for the COVID, you have seen the last couple of weeks, the Ayush Ayurvedic medicine for the COVID treatment of the immune boosting. There is a clinical trial between Indian researchers and the US. Okay, there's a clinical trial going on. So even there is started now. So even the Western countries, they are opening up to the Indian traditional medicine, Ayurveda, etc. I think slowly it will happen, but how to catalyze it to take to the fast track, that we are to debate.
Yeah. So my last question is about the growing fear among our PhD students, MSc students who are stuck due to lockdown, and some are stuck between the theses, and also if we start these new sandwich programs that we discussed today, then there, as you also rightly identified, there'll be a crisis later because there are no tailor-made positions to absorb them. So what is the solution for these people who are looking at a dark future after doing PhD or postdoctoral fellowship, if there are not enough jobs to absorb them as teachers or scientists. So what according to your wisdom and wide experience should be done? How should they visualize their future? As
I
job
think this is
seekers,
a very
as teachers, or something else?
now this is a very burning question, not only for the Ayurveda people, even in the modern science and modern biomedical research. The even the scientific agency like DST and then the DBT, we have discussed a lot even amongst our circles. I think we are producing a lot of PhD in the country. Okay, even in the modern science, even in the worldwide. So where are the academic jobs for these people? I think the academic jobs are only few. You cannot double it up, triple it up, the way we are tripling up the PhD produce. So we have to provide an opportunity for those PhDs what we are producing. We cannot leave them on the street. After some time, there will be a social chaos. When the more people on the street, the educated people, there will be a revolt. I think this we are aware of this problem. I think slowly the institutions and then the scientific bodies and policymakers are willing to give additional soft skills even during their training process. Like in the BS or MS, not only the structured course for the degree, but there should be additional soft skills so that after their degree, whether the master's or the PhD, they need not depend only on the academic jobs. They can take patenting and then the science journalism. There are so many avenues for this today. And then these have to be integrated. I think I can share with you even in the ISER system where BSMS program, we're already integrating the soft skills in their training program.
Excellent.
And I should also tell you that we have recommended to the ISER that even the data science, artificial intelligence, they should be given at the BSMS level itself. So the data science is another way of expanding our opportunities for creating jobs. I tell you in the future, artificial intelligence will be a major factor in terms of our knowledge and then integrating everything in our biomedical research, definitely. So like even in the Ayurveda and the yoga, I think artificial intelligence will come into picture.
Bioinformatics and data.
Yeah.
And eventually this will become an entrepreneurial job,
entrepreneurial.
combines the soft skills and the real skills. So the entrepreneurship is probably a good solution to an employment. So a job provider rather than a job seeker. That is what you are.
Yeah.
So I think we had a very nice discussion with you, and in the interest of time, and although we can go on and on discuss educational reforms and things, but I would like to, I think we'd like to just bring it to a close here. And thank you for sparing time. And I know there is a lockdown going on in Bangalore. We got you at the right time, so you don't have to go today.
It's starting again tonight.
It is starting tonight?
Yeah.
Already started. Okay. So
thanks
thank
very
you
much.
very much. Thanks for coming.
Thanks.